24th. Regretfully, we've lost 22 West Virginians. It's still a trend of looking significantly better. I'll get into that in just a second, but it's 22 great West Virginians. It's 22 families. It's 22 lots and lots and lots of people that are their loved ones. Boy, I hate this. I really do. 2,264th death in West Virginia is an 83-year-old female from Wyoming County. Our 2,265th death is a 60-year-old female from Mercer County. Our 2,266th death is an 86-year-old female from Randolph County. Our 2,267th death is a 59-year-old male from Lewis County. Our 2,268th death is a 75-year-old male from Preston County. Our 2,269th death is a 79-year-old male from Mercer County. Our 2,270th death is a 77-year-old female from McDowell County. Our 2,271st death is an 86-year-old female from Lewis County. The 2,272nd death in West Virginia is a 103-year-old male from Mercer County. All these people are wisdom. But can you just imagine the wisdom that this man passed on to all of his loved ones, and now this terrible, terrible killer takes him away? The 2,273rd death is a 70-year-old female from Mercer County. The 2,274th death is a 70-year-old female from Mingo County. The 2,275th death is an 89-year-old female from Mercer County. The 2,276th death is a 95-year-old female from Mercer County. The 2,277th death is an 80-year-old male from Berkeley County. The 2,278th death is an 84-year-old female from Grant County. The 2,279th death is a 76-year-old male from Wood County. The 2,280th death is a 90-year-old male from Kanawha County. The 2,281st death is a 78-year-old male from Boone County. The 2,282nd death is a 79-year-old female from Mercer County. The 2,283rd death is a 57-year-old male from Mercer County. The 2,284th death is a 76-year-old male from Marion County. The 2,285th death is a 57-year-old male from Logan County. 22 great West Virginians that I've just read you. Every single one of them so important, and we miss them. Please keep them in your prayers, your thoughts, and let these families know just how much you love them and that they're not alone. We've lost 2,285 West Virginians now. It's a crying shame. We have 285 new positive cases in the last 24 hours. That's great compared to where we've been. Our positivity rating is at 3.32. That's terrific as far as a daily positivity rating compared to where we've been. Our cumulative number is at 5.50, which is really good compared to where we've been, and it continues to come down. This is the best. Our active cases are 8,528. It's 39 straight days that our active cases have decreased. Our recovered cases are 119,337. And if you pull the chart up and where you can see, the top chart is the chart that it tells us, about our recovered cases on the bottom in the dark blue, our active cases on the top. We continue to, I think that's right. Is that right, Jordan? And we continue to widen and everything, and that's really, really good. We have 296 people in West Virginia that are hospitalized, 78 hospitalized in the ICU. We have no red counties in West Virginia, which is terrific. If you're 65 years of age, it's just a reminder, and you get that sniffle or headache or tiredness or whatever, just anxiety, please go get a test. Please, please get a test. From the standpoint of our antibodies, we can get those antibodies to you and save your life if you'll get the test, and we can do it and do it early. Now, I've got some announcements here. You know, the West Virginia State Board of Education passed a motion yesterday requiring grades K through 8 to return to full 5-day instruction in the state of West Virginia. I think that is wonderful. I absolutely believe with all in us that we ought to be back in school. And so we ought to be back in school full time, and our kids need it so badly, but our families need it as well. The move replaces the January 13th motion that required counties to offer at least a blended learning for families. And this does not affect families that have chosen to go 100% virtual. You know, that is a family decision. If they want to keep their kids out of school and keep them at home and do it virtually, that's fine. As part of the meeting, the board recommended high schools return to 5 days in-person instruction as well. However, because older students may transmit the virus at rates similar to adults, grades 9 through 12 may remain with blended instruction if the infection rate in the community is high. According to the motion, counties are to return to a 5-day in-person model for pre-K through 8th students no later than March the 3rd. Our Hatfields and McCoys trails, Southern West Virginia, you know, I see you in action all the time when I have the opportunity on a weekend or whatever to run down there. But yesterday I announced that the Hatfield and McCoy Trail system in Southern West Virginia logged in another year of record-breaking permits in 2020. Now just imagine this. In 2020, we were shut down for all practical purposes, ever sold. And in the system's 20th, it is the system's 20th consecutive year of growth in ridership. Despite an 8-week closure for COVID, permit sales still saw a 15% increase over 2019. West Virginia is an industry leader in outdoor recreation, and our beloved Hatfield and McCoy Trail system is a gem unlike any other. Since I've been in office, I've had the privilege of seeing this trail system expand to include more miles of trails and welcome new tourism business to support this increase across our state in ridership. Keep doing what you're doing down there, guys. You're doing great work, and because it just keeps on working and everything, I could not possibly be more proud. Now think about this. We've got the West Virginia Power coming back to Charleston, West Virginia. Professional baseball is on the way back to Charleston. This morning, the West Virginia Power announced that they are joining the Independent Athletic League and have merged ownership with the Lexington Legends Ball Club. The Athletic League offers an open classification to play, the highest level of professional baseball other than the Major League Baseball. You're going to be able to see some of the best players in the world right here in West Virginia, with nearly half of the Atlantic League players having already. This is the absolute home run for Charleston. I could not be more proud. I've been on the phone with the Major League Baseball commissioner, Rob Mansford, and we've worked on this nonstop. I could not be any more, happy. And so, from the standpoint of having the Atlantic League here, it's really great. That's great stuff. I told him how much baseball meant to West Virginia. He got it and everything. He promised that things would happen, and they would happen here. I really appreciate all that he's told me, and he's assured me that professional baseball would be played in Charleston in 2021, and now it's official, and I thank him with all in me, and I'm excited to hear that crack of the bat in Charleston. That's great stuff. Friday, I announced we were lessening restrictions. Several restrictions that we have lessened on small businesses, schools, and public gatherings are now in effect. They're on our website. We may have to reinstate some restrictions if we see another surge that comes along, and it is still mandatory that you wear a face covering. in all public buildings, at all times, unless you're eating or drinking. Our guidelines we must continue to follow from a safety standpoint. These include, mandatory face coverings, and all the stuff's up on my, website. Our vaccine distribution update, we still continue to lead the nation in first and second round doses. West Virginia, you've made me so proud. It is unbelievable to just think. Now, let me just pause just 1 second. Just think about this. In West Virginia right now, in first round and second round doses together, we're at 102.3% of the administration. It's amazing. It is unbelievable. Our goal is 100%, but we're getting more out of the vials than what they're telling us are in the vials. Now get this. We are in West Virginia, and it just came out, I think the BBC or whomever in Europe and everything, but and that is shining a light on West Virginia, but they also announced that we are the fifth best. If West Virginia were a country, we would be the 5th best in the world. In the world. I mean, that's not too bad for little old West Virginia. So really and truly, we're first in the nation and 5th in the world. And so now they're telling me 2 different things here. They're telling me maybe we're 7th in the world. I don't care. If we're 7th in the world or we're 5th in the world, it doesn't matter to me. I was told on the way down here that we were 5th in the world. But nevertheless, that's pretty daggum good. The best numbers are this. Today we have put in arms of West Virginia's 443,223 doses. And, hats off to all the community and local health departments and all the local health partners that have been phenomenal, DHHR, National Guard, all the people. I mean, you've done a whale of a job. You should be so proud. I mean, I don't know how in the world it could possibly be any better. The Johnson & Johnson vaccine's on the way. The U.S. FDA released an analysis of the Johnson & Johnson COVID-19 vaccine this morning that supports its authorization for emergency use. It is a one-shot deal, and it's on the way, and Dr. Marsh will be talking more about that in just a few minutes. As far as our vaccine scheduling, the thing that we put in place, again, first in the nation in doing it, to be able to, bring your registration up to where we were able to get stuff, to get, notifications to you and a text, an email, a phone call, and let you know when and where you're going to be able to get your shots. It took so much stress off from people calling all day long trying to get through to somebody and everything. But if you are in these counties, listen closely to me, Mercer, Mingo, Wayne, Mason, Jackson, Monongahela, Mineral, Morgan, Berkeley, and Jefferson counties, we need you to go online and pre-register. And if you have trouble doing it and you can't figure out how to do it, just call us. We'll walk you through the stuff and we'll get it in there. It'll take about 10 minutes to do it. 287,000 have registered as of this date. Our Saving Our Wisdom clinics and everything are up in 55 of our counties. You got to watch about the weather, and we surely don't have enough doses yet to get every single dose in every arm, but it's coming. Guys, it's really coming. We have gotten doses, now get this, in 152,096 individuals. 152,096 individuals of the age of 65 and older have got their shots in their arm, and 79,268 have gotten a second shot. We've saved a pile of lives here. People that were hopeless, people that didn't think that they'd be getting their first shot till April. We have saved a bunch of lives here, and that's good stuff. As far as our COVID vaccine info line, that's up. As far as our vaccine reminders, I want to tell you over and over, if you're in line to get 2 shots, you need to get 2 shots, Pfizer. It doesn't need to change from Pfizer to Moderna. just absolutely know you've got to get 2 shots. And the other thing is, your best defense in the meantime is absolutely this mask. Wear your mask. As far as all of our testing places and everything, they're all up on the website there. We want to especially thank Walgreens and Pruitt for all they're doing. That's good stuff, and we really appreciate that. Go get tested. It's free. Doesn't cost you a dime, and it absolutely will save your life if we can catch something really early. We have 14 outbreaks in our long-term care facilities. Amazing. Amazing. It's really great. We now only have 1 outbreak in our church community. We have Fayette that is out of this outbreak situation. The only outbreak we have in our church community now is in Webster County. And we want to encourage people to remember what I've said about keeping that pew in between you. Absolutely wear your mask. Do all the social distancing. Wash your hands. Absolutely just take all the precautions we've told you 1,000 times over. And if by chance you'd be over 65 or whatever like that, and you'd want to get your church services from home or whatever, absolutely it may be the thing to do. As far as corrections, well, let me go back to the church communities. I just want everybody to realize we're close. Now, we don't really know what's going to happen. We may have one of these variants, whip back on us and another problem. But right now, for all that we know, we're close. We're close to getting this thing conquered. And we want to stay right on it with both feet. Let me just say just this, and I'm going to ask for your prayers for a great man, Tiger Woods. Tiger Woods has brought an awful, awful lot to this country. He competed, in the golf arena, and it was phenomenal what he did, beyond belief phenomenal. I grew up as a golfer. I played hundreds of rounds of golf with Sam Snead. I played in golf tournaments with Sam Snead as far as the Pro-Am. And what an incredible, incredible talent he was. Tiger Woods tied Sam Snead as far as having 82 victories, and Tiger Woods greatly surpassed Sam or Mr. Snead, that I always called him, in many, many, many different ways. Tiger Woods wrecked his vehicle, and literally the vehicle rolled over multiple times. He has compound breaks in his legs, surgery in his legs. Absolutely, he's going to be okay. He's going to live, but it is a blow like you can't imagine, and a blow to an icon, a sports icon. So keep him in your prayers. I've had the opportunity at the Greenbrier in West Virginia to play golf. He and my son played together in the Pro-Am, and a talent like, honestly, I've never seen. An amazing, amazing talent. On corrections, I want to tell you that 22 inmate cases is what we have now, and 10 staff cases. 16 of those cases are at the Southern Correctional Facility. I want to remind you again about wearing your mask. You got to do it. Please, please, please do it in all public buildings. This is not a time to drop your guard. Please, please, please wear your mask and keep your guard up, because this thing can snap back on us. I want to remind you, if you've had the blessing from God to have recovered from COVID, go give blood. I mean, come on. If you can do it, it's what you ought to do. As far as an additional virtual town hall, and we're going to continue to do these until I am content that people understand what I am trying to do in regard to our state income tax. I'm trying with all in me to make it as painless as I can possibly make it, and give us opportunity beyond belief. Opportunity like you can't imagine. Opportunity to raise wages, to drive job opportunity here like crazy, to raise your property values, not your property taxes, to raise your property values, and to give you a standard of life that is absolutely what so many states have, that we've wanted for a long, long time. And to achieve that, I'm wanting to try to achieve that with absolutely a net positive to all West Virginians. Now, I'm struggling a little bit on a couple of the brackets, but for all practical purposes, I'm there for overwhelmingly the majority of our people, but I want to really keep trying to get there on everybody. Call in. I'll answer your questions. We'll keep at this. I am telling you without any question, hands down, this is the most important economic thing that has come down the pike that West Virginia is able to do ever. And with that, with ever is a great big word. But with that, now is the time. Now is the time that everybody in the nation and the world is looking at West Virginia. Now's their time, West Virginia. So call in, let me answer your questions. Thank you a bunch. I'm done.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. It's wonderful to be with you, and I want to reinforce a few things that the governor mentioned. Number one is that we anticipate having a new vaccine that will become available for us. Friday, the Food and Drug Administration will meet to assess whether the Johnson & Johnson vaccine will become the third vaccine receiving emergency use authorization in the United States. And the preliminary evaluation of the safety and the benefit of the vaccine has been done and assessed. And this vaccine looks like it's very safe. It looks like it's very, very effective, particularly against inhibiting or reducing severe complications, which include people being hospitalized, people going to the ICU, people going on a ventilator, but also deaths. There's no severe complications after the 28-day window and beyond, or any deaths in the Johnson & Johnson vaccine group that span people of many ages and also covered many countries. So that is really good news. And then the CDC, the Centers for Disease Control's Committee, the Advisory Committee on Immunization Practices will help position where they believe this vaccine should fit. But given the benefit in saving lives and reducing hospitalizations, we hope that the wisdom of the FDA and the CDC will allow us to add this to our current strategy in focusing, as the governor has said, on our elderly part of our population, our vulnerable part of our population, the Save Our Wisdom campaign, and by really targeting the people who are the most vulnerable in long-term care facilities, assisted living, also in our over 65-year-old group, as the governor said, we have seen dramatic improvements in week-to-week death rates, even though the governor read way too many names today at the beginning of this press brief. We have seen an over 70% reduction in week-to-week deaths over the 2021 year so far. And we've also seen a dramatic reduction in outbreaks and in hospitalizations and in ICU requirements. So we believe the strategy is working, but as the governor said, it is not time to become complacent. And we really want people to remember very much to wear your masks. And somebody had written in and said, can you just review how to wear a mask and just to make sure that we want the mask to cover the nose and the mouth. We want the mask to fit snugly over the nose and over the face. There's been a lot of work done that would suggest that if you want a double mask, that can be helpful. And the benefit of that double masking, whether it's a mask and a gaiter, one of those sleeves that you pull up, or an over the ear loop kind of surgical disposable mask with a cloth mask on top, is not only the potential for increased kind of barrier protection so that you have more layers between you and other people, but it really is about the tightness of the fit around the face. So you really want your mask, if you wear a single mask or if you're going to wear two masks, to be a good snug fit around your face. And again, as we said early in this pandemic, the more people that wear masks, the more effective they are. And we know that if 90% or so of people wear masks, then we get the same benefit on the reducing transmission rates of these viruses like we do when we get immunized. There's also data suggesting that immunization is perhaps better than even getting sick and recovering from native COVID infection. So it really does re-emphasize the the request that we all make that when it is your turn to take the COVID vaccine, please, please, please choose to take it. And please register in our state registration system so that we get every West Virginian as part of that system so that we can make sure that we identify you as part of these important priority groups as we continue to work to really focus very simply on the target of saving our citizens' lives and enhancing well-being, while at the same time, in the same way, reducing the pressure on hospitals and maintaining that function in healthcare and in our communities. So thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. Very busy this week with the Interagency Task Force. Yesterday, we did receive the final doses from last week, so those all went out today. We're still receiving in this week's doses. All those are attributed to weather across the country and everything from packaging to the actual production of the doses across the country. Yesterday, we had some confusion with two counties, one Eastern Panhandle, one related to Harrison County with our Walgreens system. There was a glitch in our system on our end, not Walgreens, that scheduled some people in different counties from where they reside. That was resolved mostly yesterday, maybe a couple more to do today. That's part of the role of the Interagency Task Force, is to address and limit challenges that we have going forward. So we'll be continuing to work that. We are also working this week and next to continue to balance out doses across the states and or the counties. And as we get more doses in counties, we'll start to see more doses as we again continue to focus on age 65 and above, as well as starting to focus on critical workforce above the age of 50. Want to just point out some great work this weekend. Wayne County, as you know, suffered from a significant outage in power. That didn't stop the Wayne County group from getting vaccines done. With the help of emergency management and other folks in the county system, a generator was put in place and all of their doses were administered despite not having power. So great work by the folks in Wayne County, and we appreciate their efforts, and we will continue to press forward as we get more doses to get them in arms as quickly as possible. Thank you.
All right, thank you, sir. Next is Secretary Bill Crouch with the West Virginia DHHR.
Good morning, everyone. We have a great number of people in DHHR who have gone above and beyond with regard to this pandemic. I want to give a shout out to the staff of the COVID-19 vaccine info line. They are in the process of manually registering 2,000 homebound individuals that we received from the Bureau of Senior Services. We're looking to try to get individuals who are homebound and individuals in our group homes, et cetera, who can't get out to get a vaccination. We're working on a way to get to those folks and give them their vaccinations. But this is a tremendous undertaking by this staff. That's in addition to about 3,000 calls they're taking a day. They're keeping the wait times under 3 minutes. So please contact, if you can't use the online system, contact the call center. They will get you registered in the state vaccine registration system. So big thanks to John Lopez and his team for handling this important task. As the governor said, we're #1 in vaccine administration in the country and doing extremely well across the world. So I want to thank our DHHR staff for getting our citizens vaccinated as quickly as we can. Thank you.
All right, thank you, Secretary. And finally to Dr. Aina Amjad, our State Health Officer.
Good afternoon. Just to encourage people in the state that we do have testing available at many pharmacy chains as well as FQHCs. But if you go on our website and see the testing sites that are available, we do encourage everyone that we do need to get tested if you're showing any signs of symptoms of COVID-19. that can be still signs of a sinus congestion or underlying fatigue. But we do need to remind people that you still need to get tested, especially some of our bordering counties that we're seeing outside there, that you do need to be concerned. As Clay mentioned earlier, we still need to wear our masks and be vigilant. Our numbers do look good, but we do need to be consistent with that. We don't want you to be scared, but we want you to be mindful of that as well. Thank you.
Thank you, Doctor. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon, or good morning, rather, Governor and cabinet members and fellow members of the media. Despite the good numbers you're getting out on the vaccinations, I'm still hearing complaints that the Eastern Panhandle counties are getting a disproportionately low number of vaccines, Berkeley, Jefferson, and Morgan counties. And I'm wondering how concerning that is, or why that is, number one. I know a lot of those folks work in the Washington, D.C. area, so I assume many of them are under the age of 65. But folks in the Eastern Panhandle are wondering, especially some of the delegates, why they are not getting what they think is their fare of the vaccines.
General, please.
Yes, sir, Governor. Mark, and I've had several conversations with the elected representatives in the Panhandle. As you know, early on, with our focus on nursing home, assisted living facilities, as well as critical healthcare staff, we knew that there was going to be a level of imbalance across our counties. For example, Kanawha County has 11 nursing homes, multiple assisted living facilities, and 5 hospital locations. So we knew that was part of the reason that we put the data on the website, was to show transparency. The governor has pressed us to do that. We developed the 55 county capability distribution system about a month ago. That had been inhibited a little bit by weather. But we have a benchmark right now at 15% for each county, and we know that we have load to balance, and that's part of what I talked about with our elected representatives as well as media outlets up there. You will see as the weather issues resolve that over the next 2 weeks and over the next 30 days, we believe we will balance it out. It's not just the Eastern Panhandle. There are 28 counties below the threshold that we want to be at for all of our counties. And let me assure you that the governor has given us direction that he wants all of us to cross the finish line close together, and we are working that diligently.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to follow up a little bit on Mark's question, but about the Johnson & Johnson vaccine. Can we talk a little bit about how the Johnson & Johnson vaccine will change the state's overall strategy, since this is a one and done shot and it doesn't require the same cold storage? How are we going to decide who gets what vaccine, which one goes where? Thank you.
Dr. Marsh and General Hoyer, you guys take over.
All right, I'll go first, Jim, and I'll let you run anchor. So thank you for that question, Charles. And we do hope that the Food and Drug Administration and the CDC will focus this vaccine in the same ways that they focus the Pfizer and Moderna vaccine, because of the ability to transport this vaccine easier and the fact it's one shot. There is benefit to moving, to some of our more austere rural parts of our state where people may have a harder time getting access to vaccine. But we also know that ultimately our goal, it really comes down to saving lives and reducing severe disease. And all 3 of these vaccines do a really extraordinary job at doing that. And because of that characteristic, my hope is that we can add the Johnson & Johnson vaccine into the same areas of focus for our prioritized part of our population as we're doing with the Pfizer and the Moderna vaccine. But that in some ways is dependent upon what the Food and Drug Administration gives the emergency use authorization for that vaccine. And then we will be influenced certainly by what the CDC recommends as well. Jim, I'll turn it over to you.
Yes, Charles, just to add to what Clay said, again, we'll focus on our existing populations that we know reduce our death rate and our hospitalization rates. And we don't, in West Virginia, don't feel that we have to worry too much about the environmental pieces and that additional piece that the Johnson & Johnson vaccine brings to us. Because of our hub and spoke concept, we're able to get vaccines out quickly, even with bad weather, and get them in arms. And we have an objective each week that the governor's given us by Sunday, and we adjusted a little for weather this last 2 weeks to get those shots in arms, so that that piece really doesn't play significantly to us right now.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I go back to the beginning of the pandemic, and I know we had a lot of things put in place, mask wearing. I know, Governor, you had a problem with not touching your face there for a while, something you had to be schooled up on a little bit. I want to talk about deep cleaning and how much cleaning really has to be done now in order to prevent the spread of disease. It probably wasn't a bad idea to have to clean and wipe down surfaces, but how much is really necessary after we've been with this pandemic that is, for the last year?
I think Dr. Amjad maybe can answer this, but let me tell you this. It is amazing how good a work that is being done. I was at our ball practice, and at the conclusion of it, one of our coaches is taking this machine and going all around the gym and spraying all the areas in the gym, where people have been or been, primarily. I just think you've got a lot of work that's going on behind the scenes. This individual is a teacher at the school and knows what he's doing, but it is just you got a lot of good work going on. But Dr. Amjad, please go.
Thanks, Paul. Those are good questions. And, in the beginning of the pandemic, we did not know as much about COVID-19 as we do now. But to answer your question simply, we would still recommend wiping down surfaces with at least 70% alcohol in it. We do know that COVID-19 is mainly spread through respiratory droplets, hence the mask wearing and these recommendations that we have. Deep cleaning has many meanings to many different people. But as far as wiping down surfaces, we do still recommend wiping down surfaces that are highly touched by many people. People were wiping down doorknobs and at least highly touched surfaces, maybe, computer surfaces or desktop surfaces that many people are, coming across. But, I know in the beginning of the pandemic, people were wiping down, every object that was coming into their household. They were holding things down at the doorway and things like that. But, I think using some common sense approaches with wiping down things, but I would still recommend, vigorous hand washing for, at least 60 seconds with soap and water, using handheld, hand gels, and wiping down with at least 70% alcohol, highly touched surfaces moving forward, especially with the variants that we're seeing. But hand washing definitely needs to be done anytime with any type of diseases out there. Thanks.
To me, just 1 second. And Paul, I would just add one thing. You're right. In the beginning, I struggled a lot with touching my face and everything. I'm still struggling with the same thing, and I'm pretty animated when I talk and everything. And so don't watch me, people, because I'm still struggling with just that. But I'm confident that others are doing a better job than I'm doing.
All right, thank you, Paul. Next, we'll go to Mark Cram with WDVM.
Good morning from the Eastern Panhandle to everyone, Governor, and everyone else. A little more than 10 days ago, a clinic was held at the Charleston Coliseum where you were able to dispense more than 5,300 shots in one setting. There's questions whether or not you may be holding similar clinics in the Eastern Panhandle or in other places across the state. Second, several times you've mentioned the plan is to finish dispensing to the vaccine to 65 plus all about the same time.
I can answer it, but I think you can do it better.
Yes, sir. Yeah, Mark, on those 5,300 doses, I don't have the exact count, but I can get it to you later today. But a significant portion of those were second doses from when we were doing our healthcare workers early on, particularly those working in the hospital setting. We do have plans as we get more doses to expand out to larger clinics when we get more doses, as well as expanding the number of pharmacies who will be available in the federal pharmacy program going forward. Again, the dates and times that we would give you will change based on the number of doses that we get available to us through the federal system. It looks like right now, based on what we've seen nationally, that more Pfizer and Moderna doses will become available over the next couple of weeks. Our goal right now with the doses we have available, if that doesn't change and stay static, is by the end of March, first week of April, we should come close to completing most of those folks over the age of 65.
Mark, you got to know this and everything, that absolutely every dose that comes into this state is armed. And so with that being said, you know, I would be a real advocate. I would love it beyond belief, you know, if we had a situation to where we could pull into the Eastern Panhandle and do 10,000 in a day, that would be fabulous. That's all there is to it. The problem is just one thing and one thing alone, and that is just, we just got to get the doses. Now, the light at the end of the tunnel is getting brighter because Johnson & Johnson's on the way. Pfizer and Moderna absolutely are amping up their production. And Mark, what's going to happen, as sure as I know my name, is just this. This will pass. This problem with not getting enough doses and not getting to everybody will soon pass, because we're going to have the vaccines in this country, and we're going to be able to get them to everybody and get them to everybody quickly. But I can't tell you when that day is going to come, but at least we can see it. We can see it at the end of the tunnel. So, Mark, I love your question and everything, but just know that these great people, they're getting it done. I mean, that's all there is to it.
All right, thank you, Mark. Next to Suzanne Elliott with the Dominion Post.
Concerted efforts being made toward people with disabilities, developmental disabilities, getting vaccinated. Is there any program for that, or is this making sense? Do you see what I'm asking? Like,
I think it makes all the sense in the world. It's a super valid concern and admirable in every way. I think Secretary Crouch can answer it better than I, but it is absolutely something that we should always be aware of and try with all in us to solve that riddle. But Secretary Crouch, please.
Yeah, thank you, Governor. And the governor is right on target. This is an important population that we're planning to try to get to in various ways. We're looking at mobile vaccination efforts that we can actually go out to people's homes or to group homes where we have the intellectually developmentally disabled folks who really can't be transported very easily to vaccination clinics, and we certainly don't want them waiting. So we're working on that hard. General Hoyer is making great strides in the GIADF with that. We actually went through a list last night with Dr. Marsh and looking at those individuals, and we're looking at getting those folks into the system. And as Clay talked about, the Johnson & Johnson vaccine is going to make that much easier, I think, in terms of how we do that. So thank you. It's an excellent question and a good point.
All right, thank you, Suzanne. Next to Katie Coyne with the Charleston Gazette-Mail.
Hi, Governor. Thanks for taking this. You know, we're our rates have been down. They're consistently going down. I think we'll all agree that you're right. It's not time to be complacent. There are hundreds of people in the Capitol every day. Everyone that works there, have been offered a vaccine, taken it if they want. I'm wondering, as we move forward with these vaccination processes and, the situations are getting safer, when are we going to allow when are we going to allow in-person press conferences again and press into there face-to-face to ask you questions and follow-ups?
Well, I don't even know how to answer it. Let me just say this. I have town halls. I have been so transparent. It is unbelievable. Unbelievable. I take every one of your questions and I answer them. I don't dodge questions and everything else. I answer them. I'm telling you, we're trying to do things as safely as we possibly can do them, and we'll continue to do that. And I really don't have a good answer for when that's going to be. Even reporters, I guess, from the Eastern Panhandle join us all the time, and we welcome them to join us. And so wherever it may be, I welcome the questions. I will answer all the questions. I'm very, very proud of what we've done, and so we'll just keep on doing that.
All right, Governor, I'll turn it back to you.
I think something that should probably be said here is just this: the paper that was just on, was talking. They ran an article and everything said that that there was something to the effect that I think is Hoppy or Brad McElhaney and everything that said, that I take things personal from time to time. Well, I'm passionate about what I do. I'm really, really proud, of what we've done. We've tried to be completely transparent at all times and everything. But all I would say is if you're going to report something, just report the truth. That's the furthest thing from the truth in any way. That was in regard to my emergency powers and everything. I personally believe that from my standpoint, I want to be 1,000% transparent. It doesn't really matter to me. It doesn't matter to me whatsoever about who looks and who oversights and who approves and disapproves and all that kind of stuff. At the end of the day, I want people involved. I welcome people to be involved at all times, except for one thing, and that is just this. The people of this great state deserve more than just arguments. And really, I'm not taking anything personal. I didn't say anything like that at all. Basically what I said is, from my standpoint, I don't care. From my standpoint, I would just say for future governors, in an emergency, you've got to react. From the standpoint of the practicality of having 134 people weigh in on issue after issue, calling them back and forth nonstop and everything. Really and truly, from my standpoint, an approval of, stuff that you have $150 million and then you have to go here and get further approval. Well, of course, that's fine. That is absolutely perfectly fine with me. But report what I said. Just report the truth. I said from my standpoint, I'm great with anything they want to do. From a practical standpoint, it becomes very, very, very difficult to handle when you got to call in 134 people. They got to make a decision. And in the meantime, you could very well lose people before that decision's made. And the governor is elected to make decisions and to lead. And I really believe the people, and and we look at it all the time from not from the standpoint of polling we do, but the people are pleased with how I have handled every single aspect of their health, their safety, and the economy aspects of the CARES money and whatever. I'm going to continue to do just that, but I don't care. I don't care who has oversight and looks except I would tell you for future governors, truly, you have got to have a governor that can lead. And you know, and it doesn't matter how good, if you had 134 Jim Justices, it doesn't matter. It is going to make it very, very difficult when decisions have to be made in a relatively short period of time.